Welcome to Soul Wellness with Kristen, where we get into the nitty-gritty of various holistic modalities and explore exactly how they help you heal. I'm your host, Kristen, and I invite you to join me on this enlightening expedition where we explore the connection between mind, body, and spirit. In each episode, we'll talk in depth with holistic providers, medical professionals, therapists, and healers. Our goal is to empower you with knowledge, inspire you with stories of resilience, and provide practical tools that you can integrate into your daily life. So, find a comfortable space and join us as we explore the multifaceted world of holistic wellness. Get ready to learn how to improve every aspect of your life and simply feel good. The adventure begins now. Today, I'm talking to our newest tenant at Soul Wellness, Kate Thompson. Kate is a board-certified integrative family nurse practitioner who started Lake Norman Wellness. Welcome, Kate.
Hello, thank you. Thanks so much for having me on here.
I am so excited to have you on here. Tell us about the services that you offer.
So LKN Wellness, it started as an IV hydration thing. So some people might know it says LKN IV hydration. Started that back in September, and we were just doing that part of it, but there was a little bit more to the vision that kind of opened up and developed, and that grew LKN Wellness. So now we are doing IV hydration, but with my family nurse practitioner background, I decided to integrate acute care visits. We do sports physicals, just one-time sports physicals or school physicals, kids that need to get into college and get that done. And then we also are doing primary care and direct primary care memberships.
Excellent. And you are considered integrative, correct?
I consider myself integrative. I'm not formally trained in functional medicine, and there are so many providers that are, and that's awesome. But integrative to me means being holistic. So treating people as a whole with the holistic realm, but integrative meaning we're using more than just Western medicine to treat people. We're using complementary therapies, alternative therapies, herbs, supplements, and that's the integrative side of it.
Excellent. So what inspired you to become integrative? Because you weren't always.
No, I was not always. So I think it actually goes back to my upbringing, to be honest with you. I grew up in Ohio. I grew up on a farm, and I was, exposed to real farm life and natural things. And my parents or my mom for sure, she's a little bit more of the crunchy granola type and always questioned, vaccines and, wanting to look for more natural remedies before we got into, taking amoxicillin and antibiotics and all that kind of stuff. So she would try to treat me with things at home. That was the first part of it. Then I decided, from a young age, I knew that I wanted to be either a doctor or a nurse practitioner or something of that nature. And that, of course, morphed over time. But when I went to nursing school, that really opened up my eyes to, I went to a great school in Columbus, Ohio. It's Capital University. And the way that they taught was that there's so much more to a person. It is holistic. It is, you're not just treating vital signs. You're not treating your labs. You're treating a person. I'm treating a human that is so complex. But then, in the nursing realm as an RN, it gets to, you're easily sucked into just doing tasks and just checking off the boxes of whatever the physician has ordered for you, the nurse practitioner or the PA or whatever, right? And that's from the RN realm. My background previously to this is emergency department. I was in the ER in urgent care for 13 years. And so, I have seen, people having their worst day ever.
You've seen everything in the ER.
Oh, yeah. I would, just about. So seeing those people having their worst days, it made me just realize, man, these people, there's accidents that happen and stuff. But when it comes to chronic disease and, realizing man, they've made some choices that got them here. And so going down that thought process and things hey, how do I avoid that? Or how do I teach my patients to avoid those kind of things? Or what do we really need to go back to? Really took me back to my own roots to say, well, there's probably some natural things that we need to address, some lifestyle things that we need to address, and kind of go from there to build upon that and directing you to how to avoid these things that land you in the emergency department at, 40 or 50 or 60 or 30 or whatever. Doesn't matter. So that kind of sparked it. And then through becoming a nurse practitioner, then my first job was in integrative medicine. And that's exactly where I wanted to be. I knew that I wanted to be able to give patients more tools than just what we did in Western medicine, in the ER, we're just band-aiding something. We're giving you a pill to cover and mask your symptoms. Like, I don't want to do that. Mm-hmm. I think there's a time and a place for medications, for prescriptions. Like, absolutely. Like, I will be the first person to tell you, listen, the more tools that you have in your toolbox, the better. Is there a time and place for, hypertensive medications, for diabetic medications? Maybe a cholesterol med? I don't know. That's kind of a hot button topic. But there's just so many other things that we need to address too. Yeah. Humans are complex, and we need to address all the complexities.
I mean, this whole topic is such a hot button for me, and it's why I created Soul Wellness. Is I wanted the public to have resources. And I get really discouraged when I hear what their Western medicine doctors have told them, the medications they're being put on, and the root cause isn't being looked at all.
Right.
You're just being put on something that's going to create even more problems later. Mm-hmm. There's side effects to everything. It's like your body is made to heal itself. I mean, this has come up in other podcasts, but,
I totally agree. I do totally agree with that.
So what is your vision now for your practice?
The vision now is really just, I can say kind of my goal, and they all kind of play on each other, like from the acute care side to the primary care and then the IV hydration and all that stuff that we have, it all works together. So let's just say, like, I have a patient who, I give this example to people all the time, like I have a patient in primary care who has a GI bug or who has, leaky gut and chronic issues. It doesn't matter what it is, like whether that's rheumatoid arthritis or, IBS and whatever, doesn't matter. We are all lacking, in my opinion, we're all lacking the nutrients that we need to have. I'm not like a person that's like, oh, you should absolutely supplement your way to health. Like, I don't believe in that. I do believe in lifestyle changes that will then, afford you that if to supplement occasionally if we have something going on, but we want to kind of heal naturally. So my vision really is with the primary care, if we've addressed problems for patients, like how can I help you from a micronutrient standpoint with the IV hydration? Like IV hydration is not just for hangovers and, migraines or whatever and just getting you through. It's not just fluids. There are, nutrients that are involved in that to help to heal the body from the inside out. So even like gut health can be addressed through IV hydration or IV therapies, I should say, IV infusion therapies.
I think what you're offering is absolutely amazing because I feel like, and at least in our realm, being in this center, most of us are very integrative driven. That's what we want. I feel like the integrative drive right now is so prevalent. I feel like people are really searching for that. I think what you are offering is an absolute gold mine, and you're easy to see, and that's amazing that people have access to you. Tell us about your practice, and I know that there's membership aspect, but there's also you do a la carte services as well. So tell us a little bit about how that all works.
Okay. So the a la carte services are really like the IV hydration. People can come and do, I get calls all the time of just like, I have a GI bug or I have the flu or whatever the heck, ailment that they're going through. We just do a one-off IV. The acute care side of that, I kind of feel like it's more just like a minute clinic, like something that you would do at CVS. So like your strep test, your, a mono thing, you've got a sinus infection, maybe a headache or, vomiting, diarrhea, constipation, GI issue, just those one-off, like, man, I feel bad. I need to see somebody, make sure this isn't anything more.
Right.
That's where the a la carte services kind of reside.
And people can see you via Zoom as well, like telehealth. So
yeah.
I want to make it clear that you're not going to be bringing really sick people into our center.
No.
And I love that you're flexible about that. You're like, I can go to their car and give them a strep test.
Yeah.
Like, you're not going to bring in a whole bunch of illnesses into the center.
No.
I've entertained having primary care at the center many, many times, and I've always just kind of said nope until I met you. And I'm like, this girl is just, she fits. She fits here. We all just love you, and I love your services, and I love your flexibility that you're willing to run outside and do a strep test if you need to, or a flu test.
Right. I mean, people are sick. I do home visits as well. I try to limit those because there's just not enough time in the day. I can't see everybody by jumping in their house, going to their house and, driving 30 minutes over to, the Denver side, and then I have to go to Huntersville. And I've done it. I've been doing it, but I just can't see enough patients with the needs and meet the needs. I can't. Right. So I do have to have people kind of come in here. But like you said, we can do a strep test. We can do that out in your car and not bring you in, or if your kids are, whatever. And if I do, if I'm hey, oh my gosh, I need to really see you. Come on in. We'll sneak you in the door and close the door real quick behind you, but
tell me this, is there anything that you would not see?
Oh, there's tons of stuff I would not see.
So you're not doing x-rays here.
No.
If somebody's broken a leg or something.
No.
What are some other maybe bigger things that you wouldn't see?
Anything that's imaging. And it's even on our website where it says just a fast check. These are things that are 911 appropriate. There are things that are not appropriate here, like chest pain. Severe shortness of breath, having the worst headache of your life, having any stroke-like symptoms, weakness like that, your unilateral weakness, slurred speech, that kind of stuff is not appropriate for here.
Right.
But other than that, minor injuries, minor illness, that's what I do here in regards to the acute care realm.
Okay. And I love the fact that you do physicals,
yes.
Whether it's, a high school kid or college kid needing a physical, and even corporate physicals.
Yeah, corporate physicals are totally fine. What we do not do are the DOT physicals. So that's an added certification and a whole bunch more stuff. Those are usually done at an urgent care or something else like that.
Okay.
I do want to say, you asked about being in the Western realm and the Western medicine realm and where I came from. And people are so fed up with the healthcare system. I'm fed up with the healthcare system.
Me too.
Oh my Lord. Okay. So let's talk about that for a second.
Okay.
Because I feel if anybody has been going to any of the corporate healthcare realms in the last 20 plus years has probably seen a decline in the way that they feel they're cared for. Yes. And this is This is probably that hill that I will die on. Okay. This is my hot button. This is my soapbox. I've been in it. I've been doing it. Now, granted, in the emergency room, that's the whole point. A whole point of an ER visit or an urgent care visit is to stabilize and ship you. Whether that means I'm shipping you home, which is the goal, or that means I'm taking you upstairs to the floor.
Okay.
You're not staying in the ER. You're not staying in urgent care. We're stabilizing and we're shipping.
Okay.
But when it comes to primary care realm, people are man, I am not getting the same care that I did when I was, I don't know, a kid or something like that. I don't know. It depends on how old you are. Unfortunately, the generations now think this is probably normal, but It's not. The parents know it's not. So if I can speak on behalf of my colleagues who are in the healthcare realm, I have been in there. I have worked right alongside with them. They are good people. They are smart providers. And I can guarantee they did not go to their education and schooling or have this vision of healthcare and caring for these people in the realm that they're in.
Right.
They did not go to school to see people in 15 minutes and whip them out and throw them a pill. And that's it. That was not their passion. I'm willing to guarantee that. I work with some amazing providers. I have amazing colleagues right now that I will call that work for the big healthcare industry or companies around here.
Yeah.
I call them in a heartbeat. They're wonderful people and they care. But the way that the corporations have set it up, they cannot see the patients and truly care for them the way that they should be and that they know they could be.
Right. They're not allowed to.
No.
It's being dictated to them. And,
correct.
And I've mentioned this before in a previous podcast. I was a pharmaceutical rep for about 10 years, and I had so many doctor friends that converted into concierge medicine because they were so fed up. They didn't want to just spend 15 minutes with their patient.
No.
They, even though that's how they're trained and that's how the corporation has told them they have to be,
right.
Listen to the symptoms, write the prescription, move on to the next room.
Right.
It's sad.
Right. But like I said, people are complex. It's not that simple. I mean, if you just take who doesn't have fatigue these days?
Right.
I mean, that's so vague and that's so deep and it could be 1,000 different things.
Exactly.
But how do you treat that in 15 minutes? And then, God forbid, they say the word I have anxiety.
Right.
Because now we've got anxiety and fatigue. Oh, you probably have just depression. Here's your pill. And now we've got a whole nother realm. It's probably safe for another podcast.
I know. I know.
Yeah. But, I mean, that's the kind of thing that we're experiencing now. Everybody's on anti-anxiety meds now these days. But maybe COVID had something to do with that. Who knows? But my point is, my colleagues that are out there still in the corporate realm, I mean, I love them. I respect them. I respect their education and what they do. And I'll call them in a heartbeat to say like, hey, I got a patient. I'm sending them over to you. Like they're a specialist. What I do in my direct primary care realm, I feel like I'm just like a care manager. Like I'm a glorified care manager. I'm going to take care of you on this primary care and these minor aches, pains, broken bones, whatever. But the integrative side then starts taking deeper dives. And I take those deeper dives with patients and we go on a journey together. And that's the beauty of direct primary care. That's the beauty of having this at LKN Wellness, to be able to have those long visits, to really look through things, to evaluate all those aspects from emotional sides to, how's your sleep? What are you eating?
Right.
How's your sex life? Like, how's your stress level? How's your work? Like, how's your relationships at home? What's going on with your kids? Having all of that to look at, you can't do that in 15 minutes.
No way.
Or 30 minutes, but here, that's what's awesome about this.
Yeah.
So we have that time. We explore all those things, and then we start looking for like things that can change. Like, what lifestyle modifications can we implement? Are there a few supplements that maybe I'd recommend for you? What's the blood work that we're going to do? What are some few things that we need to take a look at? And when those are abnormal, if they're abnormal, then we can take deeper dives and say, okay, I think this might require like a specialist. And that's where the management of care comes in. Like, okay, I think you should go, maybe we need to see a deeper functional medicine person. Maybe we need to go to a nutritionist or a dietitian. Maybe we need to go to an endocrinologist.
Right.
Maybe it's time for, I don't know, like if there's female issues that are going on, like absolutely, I'll totally punt that over to an OBGYN. It's not my realm.
Right.
My realm is looking and making sure that like our screenings are good, like your health overall in general is good, or that you're functioning on an optimal level. And then how to make that happen.
As far as blood work is concerned, do you like to order comprehensive labs, or you're looking at, tell me what you're looking at, some of the things.
So it's like part of the direct primary care membership. Like we have like your CBC, so your complete blood count. That's looking at just like your standard, what your blood look like. Then we have like your CMP, your complete metabolic panel. That's looking at your organs, the function. I call that like the Gatorade test. Like that's the one that's got your electrolytes and stuff in it. Your hemoglobin A1C, that's looking at your diabetes risk factor, if you will, and what your blood sugars have been on average over the last 3 months. Your TSH is a standard, just thyroid stimulating hormone. Just what's your basic level? It's not like a super deep dive, but if that's abnormal, we're going to go for a deep dive. And then for men and women, one prostate specific antigen for the year, a pelvic examination or a PAP for the year. That's all included in the membership.
Okay.
I'm still talking to labs to figure out like the D3, but I think vitamin D3 is a huge thing that people are not evaluating. Because that doesn't, we call it vitamin D3 and we're probably not going to shake that name, but it's actually really acting like a hormone. And so that's implementing or, messing with so many things when it's super low.
Interesting.
Yeah. So we kind of need to, that's kind of our basics. That's our basic where we start.
I love the fact that integrative doctors, when they do look at a blood panel, they're looking at, are you optimal versus
normal?
Are you in range?
Yeah.
And I hear this come up so much. Oh, well, my blood work's normal. I'm in range on everything. Like,
Yeah.
that does not mean you're optimal. That does not mean you're where you're supposed to be.
Right. And that's that whole thing of like, are you treating a lab value or are you treating a person?
Yes. Yeah.
And that's it. It depends. I don't care like what your labs say. Are you functioning?
Do you feel good?
Yeah. If you do, great. Moving on.
Right.
If you don't, I guess we have some homework to do.
That's exactly right.
Yeah.
Okay, so being integrative, this is a hot button, and that's vaccinations.
Oh, I'm excited.
This is a hot button. There are a lot of integrative practitioners that are very opposed to vaccinations. They've got a lot to say about it. Tell me, what do you think? What are your thoughts?
This is such a hot button topic. I love talking about the most like awkward things too, so let's do it. Vaccines. Obviously, I come from and on my own journey, right? Like I was vaccinated as a kid, even though my mom was like, hey, let's do just a couple at a time or a delayed schedule or whatever. I did have them. And I am a mom of 4 boys. My oldest is 10. They're 10, 6, 4, and 22 months now.
Wow.
Yeah, it's a good times. So I am on my own journey as a mom, and I'll tell you, my first 2 kids are completely vaccinated all the way through. And I was still in that mindset. Like, I just trusted what was out there. And when I went to school, and even in grad school, when we go to study vaccines, everything says, like, this has already been covered. All the research has already been done. So you don't have to worry about it. You just have to know the schedule of when you're giving it. There's nothing that asks us to, like, look into it, like, do our own research on them, like, form our own thoughts about it. It's like, this is the requirements. This is what you're going to tell your patients to do. The end. Mm-hmm. And you just put a pin in that. And when you're in grad school and when you're in nursing school, it's like, good God, one less thing that I have to study. Thank the Lord.
Oh, I see.
So it's like, oh, okay. I just have to know the schedule. Mm-hmm. Moving on. Which is funny because that changes all the time too, as evidenced by the CDC website. Anyway, so from a provider standpoint, and if I can speak again for those that are still in, like, primary care realm and working for those corporations, you didn't study them. You didn't. You were told they're good, all good. They're all studied.
Nothing to see here.
Nothing to see here, mm-hmm. Right. But honestly, I don't think that came from anywhere that was like, I mean, I can probably, looking back at my nursing professors and stuff, it's not like they were like, oh, part of this, like, conspiracy theory on purpose. They didn't do that, I don't think.
Right.
That's not my gut feeling on that. My gut feeling is that they were also told nothing to see here.
I agree with you on that.
Yeah. So anyway, being put into then, like, the integrative realm as a nurse practitioner, the integrative physician that I worked for opened my eyes. And she was like, hey, so you did vaccines, right? I'm like, yep, I did. And I didn't blink about it. And she goes, why did you do the Hep B vaccine? How do you get Hep B? And I was like, whoops. Mm-hmm. Mm-hmm. Like, is my child a high risk candidate for Hep B? Nope. Are there some people that are? Yeah.
Right.
So maybe that would be a good idea for the people who are in high risk, but should it be a blanket for everyone and a requirement for everyone, or you get kicked out of the practice? No, it shouldn't be. Should nurses in the hospital be giving Hep B vaccines just willy-nilly and just, go by that or go by the orders, mm-hmm. or not question that at all? No, I don't think so.
Yeah.
It should be patient specific, like every other treatment is. Every other treatment is patient specific. Why aren't vaccines? So I don't know. That's my thought on that. But my point of all that is to say I have been on my own journey. I'm a mom who has gone from full on ask no questions, take all the vaccines, just do it. Absolutely, protect your child. To, I have some questions. Mm-hmm. And then once I read the actual studies and started, like, opening my eyes to that and hearing more and more and living through COVID, and I'll be the first one to tell you, I had 3 COVID vaccines.
Wow.
I did.
I would not have expected you to say that.
I did. I was working in healthcare realm, mm-hmm. corporate healthcare, and I was in grad school, and I've got 3 kids at home.
Right.
And I think I was pregnant with one of the last ones. I don't know. Time's flown. But anyway, I'm in that, and I'm thinking, they're threatening to fire people. I got a mortgage to pay. What are you talking about?
Right.
And then in my mind, it's like, well, I have, I've got all this past doing the vaccines, and nothing has ever happened to me before. So sure, I'll do it. Mm-hmm. Okay. So I was fine. Thank you, God. Nothing has happened to me yet. Could be. I don't know. Maybe it's down the pipe. But nothing's happened to me. But then thinking that I was like this, like, ultimate hero of the vaccine and, like, pushing the vaccines on friends and family and all this other stuff. Then I thought, oh, the vaccines for the kids are coming out. Awesome. How great. Gave the vaccine to my oldest.
Oh, wow.
Then after that, he got COVID. Imagine that. Mm-hmm. Okay, so COVID goes through our house. We all get it in, like, January. A few months go by, and I'm pregnant too with my last one. A few months go by. My second kid turns 5. Well, the vaccine's good for 5-year-olds now, right? So I had this new baby. I go to the pediatrician's office, and she's like, do you want to vaccinate them with the boosters? I said, well, my first one hasn't had COVID, or he hasn't had his first one, and he just had COVID in January. And she's like, oh, well, he definitely needs it then. And I was like, okay. And in my head, I shouldn't even say in my head, in my heart, all these mama bear red flags are going up. But But I'm like 6 weeks postpartum, having this brand new baby, and she's like, you need to protect your children. Someone who I'm trusting. And I'm like, holy crap. Okay, I'll do it. Right. So I did it.
You just don't question it.
I didn't question it. But it's like, why am I not listening to my gut? Like, looking back, like, hindsight's always 20/20, right?
Yeah.
So I'm, not listening to my gut, but I did it anyway. And 2 weeks later, oh my gosh, like hours later, my 10-year-old, on the side that he had his vaccine and his deltoid, underneath that in the armpit, he's got swelling, like lymphatic swelling that's going on. His fever is like 104. He's never had a reaction, ever, not once, to any of the other vaccines, thank God. But to this one, this booster, he did. And I was like, that's weird. He's never had that before. So I called the pediatrician. What do you guys think about this? Oh, it's just normal. I'm thinking, this is not normal. I'm talking like a grapefruit-sized bag of fluid under a 8 or 9-year-old's arm. This is not normal. It's not even where the site was. It's now in the lymphatics. And the lymphatics are all going to that area to be like, whoa, something's up.
Yep.
So I told him, my husband saw it. He's an RN as well. And he's like, I'm not doing this anymore. And at that point, I was like, I agree. Like, and I feel bad, because I'm the one that made the choice in the pediatrician's office. Okay, so there's that. Though 2 weeks later, my 6-year-old, nothing's wrong with him. Hasn't been sick. Nothing's been going on. He has a petechial rash, which is this like polka dot purple rash from head to toe. And I'm like, are you sick? Like, what the heck is going on? Like, this is absolutely petechiae. This is not a rash that's blanching. Looked weird. He's acting fine, all that. We go to the pediatrician's office. I take him in to get blood work done. And of course, like the sample hemolyzes. So we can't get it to know what his platelets are if they were, whatever. We don't get that back for another week. And in the week, it's gone. It didn't get any worse. But then he has like a history of ticks. And this is just getting into like personals. So sorry, Jack, if you're like listening to this. He has a history of ticks, those little neurological, whatever. And all of a sudden, his ticks just go rampant. I mean, just all day long.
Wow.
Yeah. Anyway, we have since calmed down. He's had like the rash again, maybe 3 times. And we've gone back to do actual blood work on the platelets and stuff. They've been fine. So it's not like his platelets are lysing or anything like that. But anyway, or abnormal. So I'm not really sure what it is. All I can tell you is that now I'm starting to listen to my mom gut, and my answer is no.
That's the biggest takeaway of this entire podcast, I think, besides the wonderful services that you provide, is that when something doesn't feel right, don't just give in. If you're at their doctor's office and they want to put you on something or they want to give you something, and your entire body is saying, no, listen to that, please. Right.
Yeah. Absolutely. Yeah. And so that's why I think like the slogan of like, for LKN Wellness is, I want to begin where you are. Because I'm also on a journey and I'm trying to figure all this out. And I told you earlier before this podcast started that, my patients are so smart. Like, I have learned so much in this time that I've been in integrative medicine now from my patients. My patients opening doors to me and being like, oh, so we tried this therapy, or, we're looking into this for, parasites and detox and all this other stuff. And I'm like, oh my God, there's so much out there. There's so much out there, and it takes a village. I don't know everything. I'm not ever going to know everything. And I'm continually learning every day.
Yeah.
And so I feel like I'm right there with you, with my patients, to be like, hey, I don't know what this is, but we're going to figure it out together. And if I don't know, we're going to call on some people.
Right. That attitude right there speaks volumes of you, that you're willing to ask for help in the different directions that you need it.
Oh, yeah.
That's amazing.
Absolutely.
That's the kind of healthcare provider you want. Not somebody that's got such a huge ego that says, nope, this is the protocol. This is the protocol. This is what you need to take. Because I have actually been in a doctor's office and heard that. No, this is the protocol. Have you even looked at my labs? No, you haven't. Yeah.
Yeah. There's some of those out there too.
Yeah.
Yeah. I'm not that person now.
No, not
There's
at all.
a lot to explore. And, a lot of this is like, having an open mind too. Is like, well, this is trial and error. What fits for, one person is not necessarily going to fit for another. And sometimes it does. And sometimes it doesn't.
Right.
And more often than not, it does not.
Yeah.
Everybody's just so different. Our stories are all different.
Well, I love everything about your practice. Tell people how to find you, whether it's social media or your website. How do they book with you?
Okay. LKNwellness.com is our website. I think we're getting the Instagram moved over hopefully this week. I don't know. Right now, I think it's still under LKN IV Hydration. Our Facebook is flipped over to LKN Wellness now too, so you can find us there. We do pop-ups for IV therapies. So we're partnering with like Halo Salt Spa out in Lincolnton, and I'm working on a few more here locally in Morrisville as well.
Okay.
Some chiropractors in the area. So we're expanding to do pop-ups and small other businesses and kind of collaborate with them. So that way I can get to know their practice as well too. And then I can refer people out to them if I feel like that's a good place.
So to book an appointment, if you have an acute situation, or if you are wanting to sign up as a new primary care
it's all
patient,
on LKN Wellness. Yeah.
So they would just go to your website.
Yep.
All right.
Each page has its own book, like a book button. But then my phone number is out there too.
Okay.
To find. It's on the bottom of the footer on the website.
Perfect.
Yeah.
You're easy to reach.
Yeah, I am easy to reach.
Well, thank you so very much for being with us and sharing your stories and telling us about you and how we can find you. I think you've got an amazing practice, and I'm so excited to just watch you take off.
Thank you. I really appreciate it.
Thank you for joining us on another enriching episode of Soul Wellness with Kristen. We hope the insights shared today have resonated with you, inspiring a deeper connection to your own journey towards holistic well-being. If you enjoyed today's episode, we invite you to subscribe, share, and reach out. Your feedback fuels our mission to bring you meaningful content that educates, empowers, and uplifts. Remember, you are a vital part of this community, and together we're creating a ripple effect of positive change.